I am extremely excited to have Dr. Alex Cahana, the Chief Medical Officer at Consensys Health, here to talk about everything around the virtual hackathon that Consensys Health is launching with partners like Hyperledger and Gitcoin for Stop COVID. So maybe Alex, if you'd like to introduce yourself and give just a little overview about what your position is, what you do at Consensys Health, and then we can kind of work through a couple of the conversation, the topics that we discussed, just to give us more detail about this and the overall idea about what you're building at Consensys Health.
Sure. Well, thanks, Ethan. Thanks for having me. My name is Dr. Alex Cahana, and I'm the Chief Medical Officer and also the market lead for Europe, the Middle East, and Africa by the virtues of languages that I speak. I am a globetrotter, and people like to think of me as a crypto health influencer. My background, of course, is in medicine. After a military career, I've been involved in healthcare and technology for at least 15 years. And really concentrated in blockchain on this mission to blockchainize healthcare, and if you wish, healthify the crypto space in the last 5-6 years, which is considered forever in our time. And really happy to be part of the Consensys Health family, knowing that we are, especially now with the pandemic looming over us, able to move forward with products that will better our community.
Excellent, excellent. I like the crypto health influencer. That's great. Yeah, I would say that I'm a globetrotter too, like you, and I think our days of globetrotting have changed and are going to be a little bit different moving forward. But thank you for letting us kind of dive into what you're working on there a bit. Just a few of the things I'd like to talk about is. You said that everybody keeps asking you what has changed since COVID. And so you kind of got the typical answers, but I'd love to hear your answer to what for you has changed and what do you think is changing in general?
Well, these are very interesting times. People expect me to say, oh, I'm working virtually or remotely, or, I'm not eating out. I'm a New Yorker, so I'm not eating out now. But actually, the main difference that I find out is that people who either ignored or didn't take seriously the work that has been done these last years in the domains of distributed ledger technology, federated learning, privacy in-depth technologies, now are suddenly starting to pay attention. So all these people never answered my emails are now texting me, Alex, my friend, how are you? Can you please get to me ASAP and fix this? Yeah. So, and just to tell you, I'm a pain doctor. And when people say, what is a pain doctor? I always say it's like a toilet paper doctor. Is when you don't need them, you don't know where it is, but when you need them, you want them right now in good quality. Right. So I'm used to be called at urgence. And so I really think that this is an opportunity to really not only rethink what is going on, which is fine, but an opportunity to really redesign and almost leapfrog and prepare ourselves correctly this time for a post-pandemic world.
Hmm. You mentioned that in preparing for kind of the launch of this hackathon, but also just some larger things, you had been asked to write down 50 words to come up with a statement that was limited to 50 words. I really liked it, and I think it does highlight a lot of good things. It's, Twitter has given us this economy of words in a lot of ways, but 50, in terms of characters, that's Twitter's already interesting thing, but 50 words is not a lot when you look at how much people tend to write about when they're trying to explain anything in a blog post or anything like that. I'd love to hear your 50 words about this.
Well, I appreciate you asking me because I really sat on it and tried to weigh every word and crystallize my thoughts. And I want to thank also the team, because this is not just me. Like in the military, we'd always say that none of us is as good as all of us. And so I'm here just representing a large community of very smart people, a family of people that are dedicated 20-hour days. And this is a combination of all their thoughts as well. And what I wrote was that private, trusted, and safe data is the medicine we need. That's the medicine we need. Private, trusted, and safe data is the medicine we need. And now, we can analyze data at its source, and with privacy-preserving technologies, create the necessary crowd intelligence to stop and cure COVID-19. And so you see that the elements in it is that right now we live in a world where data is not safe, it's not clean, and it's not yours. And of course you can get upset about it and you can say, oh, what are all these, companies selling my stuff? But there is technology that actually can make it safe and can secure it, and it can clean it. It can be trust. And when we talk about trust, we don't say I trust you because I like you, Alex. I'm talking about computational trust, that you're sure that what it is because 2 + 2 always equals 4. And also that it's yours, and that yours can be a single person, it could be as a company, it could be as a group, it could be as a community, whoever that permission was given to, but it is yours. So this whole idea of sovereignty is also important. So the combination of that type of clean and pure information that can combat all the disinformation, the infodemic that we're living in right now, together with this ability to preserve things that are personal. It's very scary, this idea of biometric surveillance of, oh, you have to give everything, your geolocations, your emails, what you like to buy, what you like to watch, what you like to read, what you like to wear, who do you talk to, what do you say to them when you talk to them? How are you blushing? Are you upset? Am I now going to be measured by the color of my face and the heart rate after I spoke to you? And someone is going to say, oh, Alex will be on a no-fly list because he spoke to Ethan, and and this is what he said and this is what he thinks. That's a very, very scary thought. And at the end, the recognition that we need crowd intelligence. We can do this. This is why we have the hackathon, so that we can bring in all those hundreds of thousands of brilliant minds of developers who meet hundreds of mentors in the space, and they talk and they build things that are helpful and useful and relevant to not only cure COVID, which is obvious, but next waves of anything else that would come.
That's great. I pulling together two of your comments there, I think are really interesting. That from the military side, you said that none of us is as good as all of us. How do we work together as a community to solve these problems? And then you also mentioned that Consensys Health is all about collaboration and not competition. So those two things really drive us towards this idea of the hackathon. Maybe you could give us an overview about what you'd like to, the problems that you think we could attack with this hackathon. What people could be, both on the, there's two sides. You're looking to bring in as many participants as possible. You're also looking to bring in as many mentors as possible from the healthcare and life sciences space. Putting those people virtually together, what are the problems that you want to tackle, and what do you think we can come out of this with?
Well, I think that one of the challenges, but also one of the opportunities in general in healthcare, it's like that elephant that 6 blind people are walking around and each one is feeling something else. So if you are a patient, certain things are important for you. And if you are a healthcare professional, other things. And if you are in the industry, you're concerned about certain things. And if you are a payer, or if you decide on policy and legislation, each one has a whole set of problems and see solutions in a different way. But when you start to analyze all these problems, they all come down to basic things, which we have a lot of data, but they're all siloed. They're all parking somewhere in a data lake or a data pool. They cannot be used. They cannot be quantified. They cannot be exchanged. They cannot be traded. So what we're trying to build through this hackathon is more than just an app or a platform or a solution. It's an operational environment. It's an operational environment that connects the base. If you imagine the base is what we have, the legacy systems, what we have, which some of it is good. We should not say that everything is not good. And on top, we have all these brilliant ideas coming in, solutions that how can we do remote monitoring? How can we do telehealth? How can we separate between those that are at danger and those who are healthy? And all these really brilliant ideas. How do you create the highways or the glue or the grid that will allow this? And people get excited from blockchain, and it's not just one thing, it's multiple things. for different reasons. Some like it because of the technology. It's just amazing. You know, there's just so many things there that is new in cryptography and all these new secure environments that you can create with software, with hardware. Others are interested in the trading. I live in New York, so God knows how many people love the whole idea of Bitcoin and currency and trading and trying to understand the economics and the behavioral economics behind it. And others, like myself, are interested in human interaction, in the peer-to-peer interaction that creates. And as a physician, you know, I always say, what is the opposite of health? And people say, oh, the opposite of health is disease. And I say that the opposite of health is isolation, is that through disease and illness, you get isolated. So it's only with connectedness, with that distributed network, that we get that journey back to health. It's almost like I explained to my 14-year-old daughter that if we take the I out of illness and we put we, what do we get? We get wellness. So blockchain really is an opportunity to create this wellness, a societal wellness that can push us forward beyond the specific solutions that I'm sure will come up throughout the hackathon.
Excellent. You mentioned when we were discussing earlier this idea of the pandemic triangle between privacy, economy, and safety. For those who might not have heard of that or seen that visual, could you explain that a little?
Of course, you know, I didn't come up with this idea. There are smarter people than me out there, but there's this interesting triangle that says that in order to keep our safety, we have to give up on our privacy and our economy. And it's almost like, you know, when you have a triangle, you can have two, but you can't have all three. Hmm. And so that trilemma, I want to say, is just simply false. Is that today, with different privacy in depth or privacy preserving technologies, like zero knowledge proof, like a trusted exchange environment, like homomorphic encryption, which, by the way, as a doctor, I was not taught that in medical school. I'm very fortunate to be next to technologists that can explain that to me in mortal language. But enough to say that I can now have the assurance that sensitive information can be transferred and exchanged according to rules that I can determine. And it's not only just having, you know, compute intense solutions. It's also the idea that we can have, you know, just the enough amount of information to come out there. You know, when I go to a bar and they want to make sure that I'm over 18, although I don't know how they could think, or 21, I don't know how they think I'm younger than that. But anyway, and I give them my driver's license, there's a whole bunch of information that is sensitive. Now, I don't mind, because I don't think anybody will go and visit me. But when my wife does it, that's very different. And so how can we also create a environment where we don't have to give everything? We can give just enough, and that it's flexible. And then, of course, comes the for me, the most exciting, you know, part that maybe people are not thinking about right now, because we're all so much worried about the deaths and the morbidity associated with COVID. But eventually, it's the ability to transform people from being healthcare service consumers to health and wealth producers. The idea that if I behave well, if I behave healthy, I can be compensated directly, indirectly, monetary, non-monetary, but using what we call a token or tokenization, or using digital assets, I can incentivize people. That right now, that incentive is just based on goodwill and, frankly, trying to scare me and say, oh, you know, if you're not going to eat blueberries now, you're going to die 30 years, 15 minutes earlier. So we have now an opportunity to really change the way we look at data, not just as an operational information that allows us to optimize stuff, make them quicker, faster, cheaper, but also take that information and use it as a source of revenue for people that it's important for them.
Excellent. Well, the objective is to have the most Ethereum based devs ever participating in this hackathon, and a part of that specifically to your role is to have 100 healthcare and life sciences mentors. Are there specific profiles that you're looking for in those mentors? Obviously, these are not people who are currently kind of on the front line having to deal with patients and work in that sense. But what are who are you looking for that can bring value from the healthcare side to the technologists that want to work on solutions?
Yeah, we put the bar very high, and I just want one thing. I want them to be uncomfortable. If a professional is comfortable, if they are in this pre-contemplative phase that everything's fine, I don't know what everybody's getting upset about, they're not helpful. There has to be an itch, a burn, a sense of urgency that we have to take care of these things now. And it's not just about supply chain, and it's not just about inventory management, and it's not just about predatory practices or how we can make things leaner and meaner and faster. It's not just about that. It's to really stop and think for a second. What really is this all about? What really do we want to achieve here? And the beauty of this hackathon, whatever is going to be birthed, whatever these doctors are going to explain to the developers describing their daily needs, because this is the first time, this has never been happened. All this health IT that we see, all this health IT that has been created since the 80s, even some of them since the mid 70s, have been done mostly without physicians. They've been done by technologists who spoke to other technologists, who spoke to other administrators, that some of them might have been doctors a long time ago, without the input of those that are on the ground. And so the ability to talk to young doctors that are actually doing now the work, and they see the insufficiencies, they see the gaps, that is that opportunity, that is that crowd intelligence that I'm talking about. Because, and it might be inappropriate for me to say that, but the technology is not hard. I'm not saying it's not hard because it's not hard. Of course it's hard. And that's why we have these brilliant minds that are doing it. But what really is the challenge is, how do you create things that are helpful, that are useful, that we overcome our blind spots and think about the communities that are in need? How do I think, not only as someone who is living in New York and has a spouse that is working at Columbia University and thinking about Columbia and what they're going through every day, but also coming from East Africa and looking at the people in Uganda and Tanzania and Kenya, looking at vulnerable and destitute populations who have absolutely no infrastructure. That's really the magic of what DLT can do. Give voice to the voiceless, bank to the unbanked, health to those who do not have any access. And unfortunately in the US, we have a lot of people who do not have the access that we think we have. And so the bar is very high. If you are comfortable, do not call us. But if there is an itch, and it doesn't matter what the problem is, you have to come and share with us that problem so that we can solve it.
Well, Dr. Alex Cahana, thank you so much for your time, your insights, taking the time out of your schedule. I know you've been busy with a bunch of interviews to have a chat with us. If people are looking to get involved, go to consensyshealth.com and apply to be a hacker, a mentor, or a partner. And I look forward to hearing more success stories once the hackathon gets going, and afterwards to hear about all the cool stuff that gets built and all the ways this has been done. Thanks again.
Thanks, Ethan. Bye-bye.